So skin cancer is when you have abnormal cells growing in the skin in a dangerous manner, and these can sometimes bud off and sort of grow in the lymph nodes or in other organs within your body. Skin cancer is rising. It's the fastest growing cancer in the UK, and really we're really battling to keep on top of it at the moment within the UK. There are two main types of skin cancer. There's melanoma skin cancer, which everyone knows about, and is a very dangerous skin cancer and can be fatal if not treated early. And then the other types of skin cancers are called non-melanoma skin cancers. The most common type and most common cancer in the UK is basal cell carcinoma, and this is a local form of skin tumour that rarely spreads to the body. And then if you like, its more aggressive cousin is a squamous cell carcinoma that can have the potential to spread to the body. People who have a strong family history are automatically more likely to have skin cancers. People who have a skin type of 1 or 2, and that basically means people who, when they go in the sun, have an easy tendency to burn and rarely tan. Also, various medications, so people who are immunosuppressed have a higher tendency to have skin cancers, and those skin cancers are more aggressive. For melanoma and non-melanoma skin cancer, there's been some new evidence showing that the use of sunbeds, especially in young people, markedly increases their risk. So for females, for example, if you used a sunbed just once before the age of 35, you nearly double your risk, your baseline risk of having a melanoma. So your risk goes up by 87%. And that fact is staggering, that we still have sort of people going on sunbeds regularly. Newer research as well has shown that their risk of developing non-melanoma skin cancers in later life is also far greater if you've used a sunbed. The recommendation from us and the British Association of Dermatologists is everyone, regardless of age or creed or colour, should be examining their skin on a monthly basis. In particular, we want patients to look out for any pigmented or dark lesions that are changing in size, shape or colour, that are becoming painful or symptomatic, and that are giving them any sort of symptoms. We use an algorithm A, B, C, D and E. So A is for anything that's asymmetrical. So if you can cut your mole into 4 different segments, each of those 4 segments should be the same. And if they're not, then that's a worrying sign. Is the border, then B is for border. So if you can draw a direct line around the border, then that's okay. But if it's scalloped, or if the borders are blurred, then that's another worrying feature. If it's got more than 2 colours, again, another worrying feature. And then anything that stands out on your body, anything that's larger than the rest of your other moles should stand out. Should alert you to seeking a medical advice. And then E really is to see an expert in skin cancer. So that's for your sort of darker moles, but for other non-melanoma skin cancers, any growth that isn't quite healing, that you think has been there for a while and it's growing, if it's bleeding, if it's painful, all of these features should want you to seek a diagnosis. Don't just leave them and think it's nothing to worry about. We'd much rather that you have a diagnosis. If you're worried about whether you have a skin cancer or not, you can see your GP, who will refer you on to us, or you can refer directly to one of our clinics, and we will usually operate on you within 1 to 2 days of making the diagnosis, if not the same day.